Matt, should I start? Okay. Good afternoon, everyone. Thank you for coming to this press conference. Thank you for those joining us on Zoom. Now, 1 month ago, I've started working on finding a way to bring down the cost of COVID testing. Now, this started being a challenge when those who needed to go and test. One second. You need to off your audio. All right, where COVID testing in private facilities is not affordable to a lot of people. And we have a situation where the government hospitals are testing selected patients, those with close contacts to confirm positive patients, and those from EMCOs and certain other criteria. But many others who had casual contact or are worried that they may have come into contact because they were in the same premises like the Maybank branch or other premises that have had COVID are worried and they want to get tested. And this is a financial challenge because widely out there, COVID test is around 300 plus ringgit, 300 and above. There are a few places performing antigen tests at between 150 to 180 ringgit, but these are also not widely known, and still maybe at 150 to 180 ringgit a bit high. So mindful of this, wanting to bring down the price for my Bukit Gasing residents, I started negotiating with facilities, healthcare facilities, to see what kind of price I can offer my Bukit Gasing residents, and that's how I got started. But because I could not get a cheaper price from them, subsidizing the 150 ringgit would be rather pricey, and that led me to look for the distributors of these test kits, as well as discuss with other medical practitioners, doctors, GPs. And in that process, to cut a long story short, we've managed to actually bring down the price. We started off with a price with subsidy for Bukit Gasing residents a few weeks ago. But today's press conference, I'm here to announce that we've managed to bring the price down, that now it is only 70 ringgit for anyone to do a COVID test by the antigen rapid test kit. And this is without any government subsidy. This is the price that the clinic has to charge to earn their income, as well as the price of the test kit combined. And so today, starting today, we are opening up what used to be restricted to Bukit Gasing residents under the subsidy scheme previously to an open one where anyone can get tested at only 70 ringgit. And so this would be the cheapest testing on the market right now, because the cheapest antigens that we can find out there now are between 150 to 180 ringgit. Now we have 2 clinics in our area in Petaling Jaya that are our panels to do this testing, and we have 1 hotline to register those who are interested in participating. And so we will give you this information in the press release. And this is something that other clinics can emulate, or other clinics who want to contact us to join are also welcome to contact us. And something which I feel that would be a game changer in bringing down costs. Now, this is something which I hope the Ministry of Health will continue to pursue at a larger scale, because if we can buy these test kits in large quantities, we are able to push the price down, and we are able to bring the price down for the end users who need to do the testing. So this is just talking about those who need to do testing on their own. There are a few categories. There are those mandated companies, industries that are mandated by the government to test their employees before they can reopen business or conduct business. There are those who just for their own peace of mind, they want to test, and they need access to cheap testing. And so this 70 ringgit that we have launched today will be able to help save costs for some of them. It doesn't have to be so expensive, and now it's open for all because it's been able to be brought down without the need for any subsidy. All right. Is there any questions at this point? No, it is not restricted to those in Selangor. It is anyone. Anyone can can do this testing.
Hello.
Yes, Farid.
YB, I just want to know, I mean, what is the duration of this initiative? Would it last throughout the month or until December or until next year?
Okay, the duration is until further notice. We don't have an end time. This is not a one-off program, so it should be going on for as long as the need for testing is there. And in fact, we are always looking for ways we can bring down the price even further from the 70 ringgit. So no end timeline for now. Okay, there was a question from BFM over Zoom. How does the subsidy scheme work actually, bringing down the price from 150 to 70? So actually, there's no subsidy involved. Now, what happened is after there were two components in bringing down the price. The first is we purchased the test kits in large quantities, not as large as MOH is purchasing the test kits from the manufacturer and the distributor, but larger than what most clinics will typically purchase. And by purchasing large quantity, we managed to negotiate a significant savings on the test kit. So our test kits are probably cheaper than what other clinics are purchasing, as I understand it, but we've managed to get a good discount from the normal price. And the second way we've brought the price down is also in how the test is conducted. Now, when you see testing happening in private hospitals, the setting is one where there are a lot of personnel involved. If you've experienced it, now I've gone for 5 COVID tests so far, since March until now, and all these tests will involve large amount of personnel wearing the full PPE as you go through the different stations before the swab is finally taken. And oftentimes after the swab is taken, then the swab is put into a vial and it's sent to a lab or a different place to process and get the results. Now with the test kit, one GP is able to do all of this by himself, and so one GP is able to take the swab and process the test kit there and then and get the results out. So we've cut a lot of manpower requirements. We are in full compliance with MOH guidelines, which requires a well-ventilated room within the clinic, which a lot of clinics are able to provide. A lot of GPs do have one room that they can dedicate to this purpose. And we also arrange the patients to give sufficient volume to the clinic so they are able to have that volume to bring the price down for the testing. All right, which company is the test kits from? This is the test kit. It is from manufactured by SD Biosensor. It is the same test kit that the Ministry of Health is using to test in government facilities. So MOH uses both PCR as well as this antigen test kit from SD Biosensor. And as I understand it, Ministry of Health has purchased 1.1 million of this rapid test kits to be used at various government facilities. Is there any other question that I've missed? Okay, so with the combination of how the work process, how many test kits are provided? So at the moment we have no limit in a sense, because we can keep getting more test kits as we do the testing, so that's not an issue. And because there is no more element of subsidy, unlike before, so there's also no need to cap the amount of tests that needs to be done or that can be done. Okay, Code Blue is asking a question that, Asha, can you read out the question? The screen is moving too fast here. Okay, just give me a...
WHO said the price for RTK antigen is around USD5, which is RM20 ringgit 47 cents. Why is it very costly in Malaysia?
Okay, so I'm not sure about whether WHO said that it's $5 per test kit, But based on the negotiations I've had with the principal distributor in Malaysia, I know that the price can come down even lower than what we are purchasing now, and $5 is not too far away for bulk purchase. So the key comes down to also volume, and this is the second part. Now the first part where I talked about how we can make testing available at 70 ringgit, this is with me purchasing test kits at a moderate volume. But if we are able to purchase test kits at a bulk volume through maybe the coordination from the Ministry of Health, I think getting test kits down, getting the test kits down by even more 20 ringgit cheaper is very much possible. Okay. Any cooperation with Selangor government to expand this to beyond the current list of participating clinic? I have conveyed this to the Selangor Exco for Health, and I look forward to see if they are able to do this. But the jurisdiction of health, COVID testing and whatnot, is actually under the federal jurisdiction. So the state can complement, but ultimately the jurisdiction lies with the federal government.
Were the test kits obtained to direct negotiations or open tender?
Direct negotiations. Like I said, there's one principal distributor of one brand. So I negotiated the price that we brought it down, and I'm very happy if anyone in the market can negotiate a better price and offer it, because the aim here is not to make money. We don't make money out of this. The aim here is to bring down the cost of testing so the public has cheap access to testing. You know, what Tony Fernandez did with AirAsia, now everyone can fly, now everyone can test. So that's the aim. If anyone out there can bring it down even further, I totally welcome that. And if you can bring it down to 65, 60 ringgit and eventually 50 ringgit, I totally welcome that. As far as we know, but I could be mistaken on this, this is the only antigen test kit that has got MOH approval, KKM's approval. But I could be wrong on that. But as I've been informed, this is the only particular brand of antigen test kit that has gotten the approval of Ministry of Health. Although in the market there are a few other brands.
Can you, this is a question from the FB Live. Can you read out the names of the clinics participating right now?
At the moment, I'm not reading out the names of the clinics because we don't want people to walk into the clinics. What we want is for people to register in the hotline and get their appointment slot, and that's the way to keep things a bit more manageable and under control. So as soon as you register with the hotline, you'll be notified of the name and address of the clinic. But if there are other clinics who want to participate in this, I welcome widespread participation. I think the last few days we've had a lot of discussion on why the private sector, the GPs, have not been roped in the war against COVID. And I think this is answering that dilemma. We are helping the GPs get involved with the fight against COVID. The way we have structured the 70 ringgit testing gives a strong role for the GPs to play. So right now we are working with 2 clinics, 2 GPs, but I see far more GPs getting involved down the road, because 2 clinics in PJ isn't enough for the whole country. You know, clinics in Johor Bahru, Penang, Sabah, Sarawak should get involved in this.
Do you have any requests for MOH with regards to lowering the price of test kits? What is your engagement with them so far?
Yes, I do have a request to MOH to lower down the price of test kits, as I mentioned earlier. The price that I'm buying now was based on a negotiation for 5,000 test kits. 5,000 test kits is a lot. I would say a medium volume, because maybe smaller clinics may only buy 100 test kits at a time. So 5,000 may be a big volume to bring the price down at the starting point. But if you're talking about a national-wide program, MOH in the position to buy in the hundreds of thousands. In fact, MOH has already purchased 1.1 million test kits. So their purchase price should be far cheaper than what we are purchasing. And if MOH can purchase these test kits and coordinate GPs to be able to do this testing, or all the other private hospitals to be doing this testing, then we can definitely bring down the price of COVID testing in the marketplace. So definitely, I call upon the Minister of Health, I call upon the Ministry of Health to enable cheaper testing for the public. Their coordination can certainly help bring down the price.
Are there any efforts to make the rapid test kit antigen testing more accessible to communities in rural areas like Orang Aslis?
So once again, I urge the Minister of Health, with regards to making this testing more accessible in rural areas, I call upon the Ministry of Health to do so. Ultimately, if the Ministry of Health can procure these kits and distribute them with clinics through an agreement, they can manage how many clinics in each rural area. This certainly can be done very quickly, very easily, but there needs to be a coordinating person. So as ADUN of Bukit Gasing, I got started on this path because I wanted to bring my constituents cheaper testing. And now that we've managed to actually bring the price down to a level that we don't need to subsidize, 70 ringgit can be done without subsidy, my team and I, we've decided that we want to open this up to everyone. So no limit, you don't have to be a resident of Bukit Gasing, you do not have to have any other requirement, anyone can get tested because this 70 ringgit is at cost.
One more question. Would people be able to request for a specific date or time of appointment, or is this assigned by the clinic? I understand Bukit Gasing folk had access to this initiative before. How is the take-up so far, YB?
All right, so we will try to accommodate a specific day for testing to the best that we can, but we also need to manage the queue. So please bear with us in case we are not able to accommodate your specific date, but we will try our best to find a slot that works for you. All right. Bukit Gasing is a relatively small community, and thankfully we have a relatively low amount of known cases, and we have no clusters that we know of within ADUN Bukit Gasing. So it is at the moment a smaller number, but I foresee that after today the numbers of requests for tests would spike up tremendously. I think now that we have covered this thing, I want to actually also touch on one other suggestion or one other urging to the federal government, is that I sympathize with all the frontliners in the government hospitals, in the government clinics that are doing massive amount of testing every day. With the amount of cases on the rise in Selangor and throughout the country, the amount of close contacts that are being called up and being tested every day is a tremendous workload on the frontliners at the government COVID hospitals as well as the clinic kesehatans. There is a way to help the situation, that is to engage the GPs to do the testing. The government can supply these test kits to the GPs, or the government can even engage the GPs to collect the swabs for PCR testing, and utilize the manpower available at all these clinics, the private clinics that are available, especially in the Klang Valley. And if we do that, we will reduce the workload on the government doctors and nurses at the government hospitals and the clinic kesehatan, freeing up their resources to help with the treatment of patients. So it is something that I strongly urge the government to consider to do. And I think this is in line with the conversation that we've been having at the public domain in the last few days, where the MMA has called out on the government to utilize the GPs in the war against COVID. This is a huge war. This is, the number of cases are not going down, the number of cases are still high. There is a lot of people that needs to be tested, there's a lot of people that needs treatment. So let's utilize all the medical resources that we have in this fight.
In light of the rising mental health cases due to the pandemic, would DAP be doing any initiatives to make mental health services more accessible and cheaper?
Arjun, don't you want to ask the Minister of Health this question? I think today we focus on COVID testing. My colleague Kelvini is more specialized in mental health. I'll leave that for him to maybe address. But I think that question is more apt to be passed to the Minister of Health. For the purpose of audio recording, okay, read out the hotline numbers. Yes, we have one hotline number, 016-306-4104. You can call this number or you can WhatsApp this number. 016-306-4104. So all you need to register is your name, address, IC number, and contact number. So there's no need for you to WhatsApp over your picture of your IC. Just very basic information for us to slot you in for an appointment with the clinic. So for any other clinics who are interested to join us, you can also contact the same number. 016-306-4104. Okay. Is there any other further question? If not, we can bring this to a close.
Where is the funding coming from to purchase the tests? Is the Selangor COVID-19 Task Force also a part of this initiative?
No, the Selangor COVID Task Force is not part of this initiative, but I've conveyed to our Exco for Health, Dr. Siti Maria, on what I'm doing along these lines. The funding, like I said, this is unsubsidized. The 70 ringgit covers the test kit and covers the doctor's fee, the clinic's fee. So the issue of funding doesn't arise because it is not funded by the government, it is not funded by the taxpayer. The 70 ringgit covers the cost of the test. It may be hard to believe, but yes, the 70 ringgit actually covers the cost of the test. And the doctors are making a comfortable fee out of this, that we are not being subsidized, or this is not charity. Okay. Thank you very much for your time. And if you ever have any further questions after this, feel free to contact me or contact Asha. Thank you. Have a good afternoon.